So how does one actually do a hyperbolic taper? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I talk a lot in this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I've talked a lot in this app about the importance of doing a hyperbolic taper when coming off of a number of psychotropic medications, including antidepressants, benzodiazepines, and gabapentinoids. And so what this means is that basically, instead of going down by a set milligram amount with each dose reduction, you're going to go down by a percentage of the dose. So usually we recommend starting around 10%, but some people can tolerate greater percentages and some people need lower percentages to go more slowly. But as most of you know, the smallest dosage that comes in a tablet form is often not low enough to actually discontinue. And our pills are not coming in the dosages required for that hyperbolic taper. So what do? So if you're starting with a tablet, you can cut the pill in half, and then you can cut the pill in half again. But you really can't reliably cut a tablet more than twice or into fourths. After that, you're just looking at crumbs. And some pills, you can't even do fourths if they're really small. So what do you do in these situations? Well, if there is a liquid formulation, this can help you to be able to taper more precisely. Of course, not every medication has a liquid formulation. Then there's also the issue of if it is a capsule, because you can't split a capsule. So most capsules are going to be filled with beads. And so you may actually have to open up those capsules and then weigh out the beads and take the amount that is indicated by the hyperbolic taper. However, in a lot of cases, if you take those beads without the capsule, then it may interfere with absorption issues. So we generally recommend putting those beads back in the capsule. Now, there are compounding pharmacies available that can actually make these dose reductions for you. However, they're not covered by insurance. They can be quite pricey. And even though these pharmacies are quite professional and they're going to be making the tablets as precise as they can, they're not regulated. The dosages are being manipulated. And so there certainly is the chance that you may not get the exact dosage that you need. So what are we to do? Well, there's always the DIY option. So you can kind of go the liquid route, which would be you could dilute the liquid further and then take the amount you need based on that dilution. Or you could also dissolve a pill into a water solution and then take a set amount of that solution depending on the dose that you're at. In most cases, this is going to make a suspension, which means that you really have to mix it up well in order to ensure that you're getting a consistent concentration. Most of these aren't going to last beyond one day, so you mix it up and then you use it and then you discard. However, we don't really have data on that, so it's kind of just, it's better to be safe than to be sorry. You can also get a jeweler scale, which is very precise and it can measure very small weights and basically just shave off the amount of medication that you need or the amount of medication that you need to shave off to get to the dose that you need. That's another option. Of course, I don't recommend doing this on your own. Ideally, you would do this with your psychiatric prescriber to make sure that they're monitoring you and making sure that you're tolerating the taper well and that you're not having a recurrence of your symptoms. If you have any other tips or things that have been helpful for you on your hyperbolic taper journey, then please share in the comments below. Also, I'm putting together an email list for those of you who are interested in my content because I may be having future courses or resources or offerings, and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email and I'll see you in the next one.